Hello, my name is Mel Leonard. I work for a large insurance company as an insurance agent. Basically, I work in the individual and family health care of this particular insurance. So therefore, I'm dealing with people all day long that either don't have work coverage, or they've either lost their job, or their work has actually gotten rid of their insurance, or any number of things. Generally, it's situations where they have the least amount of money and need insurance the most. But the trouble is that oftentimes I find myself in a situation where I have to deal with people that have pre-existing conditions. Some of them aren't even that serious, it seems, but they're enough to where it keeps them from getting normal insurance at even halfway reasonable costs. Also, there's just a lot of people that can't afford the higher prices, because individual and family insurance is always going to be higher priced and less coverage than its group counterpart, the group being insurance you get through work. It's really a shame. Sometimes I find that the people that are really in desperate need have no ability to pay the kind of money that is required so they can get insurance, especially if they need it bad. Also, the amount of, if you don't have insurance though, I have a friend of mine who spent one night in observation at the hospital without insurance. It cost him $7,800. This kind of, so you almost have to have insurance, but there's just something needs to be done, because there's so many people out there that need affordable health care. And they just can't make it the way it is now. When they're in their worst possible position, that's when it seems like they're getting hit the hardest for this kind of thing. I have seen some relief come through the Obama plan with COBRA. A lot of people that have been able to qualify for that have been able to get some real good health coverage for not that bad of a price. But unfortunately, it doesn't cover everyone. There's a lot of stipulations. So I'm really not sure what the answer to this problem is. I'm not sure we want to go with nationalized health care per se. I talk to people who come from Canada and the UK, whose health care apparently is very good. As a matter of fact, I had one lady tell me the other day that she took the preventative care results that she got here in America to her people in the UK, and they laughed at it, because it was half of what they would have done. Of course, on the other hand, you have the costs that are associated with it, because I know the people in Canada and the UK, they have a lot more money they're spending. Some of them, I've heard tales, I don't know if this is true, but I heard they pay as much as 50% of the money they make to the government for this kind of care. I'm really not sure what's the best method. I don't know who has the answer, but I know right now things aren't the way they ought to be. Prices are too high in the hospitals. They're not even justified. I mean, like my friend who spent the night in the hospital and got a $7,800 bill. All they did was run a sonogram on him and give him a couple of very kind of low-class meals, and it was nearly $8,000. I mean, that's a cost. And anyway, I'm just here to say that we need to do something about health care in America. It's wrong that we have the ability to be the #1 providers of health care, but yet we lag behind all these other civilized and industrialized countries. We give worse care for more money than anywhere else in the world. It's just, there's something wrong. And I wish I was smart enough to have the exact answer, but I think there is an answer out there. We just have to look and find it. And I guess that's really all I have to say, and thanks. I appreciate the AARP giving me a chance to say this, and I hope that they are able to forward this and do some good with it. So thank you very much for your time.